Today we have Padma Bhushan awardee Dr. T.S. Kler, Executive Director Fortis Hospital with us to share the valuable thoughts on heart disease. Sir, what are the major risk factors for heart disease?
See, first of all, I want to say that heart disease is not a one type. There are many types of heart disease. Broadly speaking, we divide heart disease into congenital and acquired heart disease. Congenital means when the child is born with the disease. Acquired means the child is born normally, he doesn't have any cardiac problem, but the disease develops on later on. When we talk about acquired heart disease, the main diseases are in India like rheumatic heart disease. This is a disease which occurs in usually children. This is the reason, the cause for development of rheumatic heart disease is streptococcal sore throat, and because of the sequelae of the streptococcal infection, the heart gets involved, the joints get involved. Joints usually recover completely, but the heart is damaged permanently. In heart, either your valves start leaking or they can become narrow. It's a common problem, particularly in younger population, because rheumatic heart disease, rheumatic fever, which causes rheumatic heart disease, occurs between 5 to 15 years most of the times. The another type of heart disease is called coronary artery disease. When we say coronary artery disease, this is the heart disease which a common man talks about these days. This is a disease where you develop blockage in the heart arteries, the arteries which supply the heart muscle. Now these arteries are called coronary arteries. That is why it is called coronary artery disease. And when you develop blockage in the coronary arteries, then a patient has either what we call it as angina. Angina is a situation where when a person exercises or he does some effort, there is a chest pain or chest discomfort, and it gets better when you take rest. The second manifestation of these blockages is that people get heart attack. Heart attack means that there is usually a sudden stoppage of blood in one particular artery of the heart, and the area which is supplied by that coronary artery gets dead. This is called acute myocardial infarction technically. We also call it a heart attack. Some of the patients of coronary artery disease, they neither give history of heart attack nor they have history of angina. They directly come with the heart being damaged, that the pumping capacity of the heart gets weak, and they come with a situation which is called as heart failure, and they have usually breathlessness on exertion. They may develop swelling over the body, particularly feet, and they get very tired. And the another important manifestation of coronary artery disease is what is called as sudden cardiac death. Some people can die suddenly. Now, sudden cardiac death in coronary artery disease also occurs because of two reasons. One reason is that if you develop sudden blockage of a major artery of the heart, for example, the left anterior descending artery or the left main artery, then people don't have time, they just collapse and they can die within 1 hour. The second reason for sudden cardiac death is that people who have already damage to their heart, they die because of the rhythm problems coming from the lower chamber of the heart, where the people get either what is called as ventricular tachycardia or ventricular fibrillation. The another type of disease is the heart muscle disease, where the coronary arteries are normal actually, there are no blockages, but the heart muscle gets weak. This is called cardiomyopathy. Then the last type of heart diseases, which is also very important, is what we call it heart rhythm problems. When we say heart rhythm problem, that means, in a normal situation, we call that the heart rate from 60 to 100 is normal heart rate. So if you develop heart rate which is more than 100, it is called tachycardia, and heart rate below 60 is called bradycardia. Now you have to understand one thing, that both situations, bradycardia and tachycardia, can be physiological. For example, when a person is sleeping, his heart rate will come down below 60, it may be even 40, it's normal. Or when a person exercises, his heart rate will go more than 100, it may be 110, 120, 130, depending upon the level of exercise or fever or whatever. So that is physiological tachycardia, it is not a disease. But then there are many rhythm problems which occur without any physiological reasons. Those are called abnormal rhythm problems, in which either the heart rate goes down, slow heart rate, or very fast heart rate, or heart rate becomes irregular, or there may be any combination of these things, fast and irregular, slow and irregular. And this thing, slow irregular, fast irregular, even can happen in the same patient. So these are the, broadly speaking, 5-6 types of heart disease which people have in the world. Now coming back to the coronary artery disease, the question which you asked, that why so-called coronary heart disease occurs. Well, we don't know exactly that why this happens. We only know that people who have got some risk factors, they have a more development of chance to develop these blockages. Now what are those risk factors? We divide them into major and minor. Major are smoking, hypertension, diabetes, and raised cholesterol, particularly raised LDL. LDL is bad cholesterol. Then we have some minor risk factors like family history of heart disease, if somebody has a increased uric acid in the blood, increased homocysteine levels, lack of exercise, and then stressful individual, stressful personality. So these are considered as minor risk factors. So it is a combination of these factors that people develop blockages. More the risk factors, more is the chance of development of disease. So obviously it is very clear that if you want to prevent the heart disease, then you have to you have to address all the risk factors.
So what are the signs and symptoms of heart failure?
Heart failure presents, the symptoms are either breathlessness, it may be initially only on activity, but as the disease progresses, a person can be breathless even at rest. Then tiredness, particularly when they have exertional tiredness, they can't work, they can't do as physical activity as other people do. Another symptom which is important actually, which people neglect, is that some people may have just cough, particularly if they have a cough when they are lying down, which becomes better if the patient sits. This should never be taken lightly. This is not an ordinary cough. Sometimes people may have severe breathlessness at night while they are sleeping, and when they get up, they sit, they feel better. So these are the symptoms of heart failure.
So what are the various ways of preventing heart failure?
Well, basically, when we say the methods to prevent heart failure, is that we should prevent damage occurring to the heart. That means we should prevent heart attacks. And as I told you before, that if we prevent if we address the risk factors, tell people not to smoke, treat their blood pressure very nicely, control diabetes effectively, do some regular exercise, do some yoga. So those are the factors, those are the methodologies to prevent heart disease.
Thank you so much for the valuable time, sir.